نرحب بالبانل الجديد Building Smart Health Systems AI Innovation from Code to Care مع المودريتور دكتور يوسف باسيم Chairman and Digital Health and Artificial Intelligence Department Hospitals Federation. Dr. Sandy Rihana to the stage, please. HealthTech expert, TTO director in biomedical engineering, professor at UZEC. Shyrine Yaghi. Hello, Shyrine.
Hi.
Co-founder and chief commercial officer of Draft Telehealth. Amazing innovation coming out of Lebanon. Rony Krayem, managing director, integrated solution business unit, IP engineering. Hi, Rony. Last but not least for today, Elias El Ramy, chairman at Maxtoy, holding healthcare management expert. Sharafna, and the floor is yours. شكلك بدك تفل.
Afternoon, everybody. Distinguished guests, colleagues, and fellow professionals. It's an honor to welcome you to today's panel discussion titled Building Smart Health Systems and Innovation from Code to Care. As healthcare systems around the world face increasing complexity and demand, and artificial intelligence has emerged as a transformative force, reshaping not only the way we deliver medical services, but also how we design hospitals, engage patients, and manage health outcomes. This session brings together a distinguished panel of experts representing key pillars of innovation, from healthcare operations, biomedical engineering, clinical care, digital infrastructure, and health insurance. Together, they will offer strategic insights and practical experience on how AI is redefining the healthcare landscape across our region and beyond. Through this conversation, we aim to explore not just the potential of AI, but the critical steps needed for its effective and ethical implementation. From concept to infrastructure, from policy to practice, today's dialogue is about building smarter, more resilient, and more responsive health systems for the future. I will begin my session by presenting our panelists. I will start by Dr. Sandy Rihana. She is a trilingual biomedical engineer, professor, and innovation consultant with a PhD in biomedical engineering. She specialized in AI in healthcare, smart medical devices, and interdisciplinary education. She's a certified product of an innovation manager, and she co-founded an accredited BME department and has led international collaboration across academia, industry, and clinical sectors. Founding director of the Technology Transfer Office at UZEC, and strategic and technical advisory board member at World Health Organization. Then, we'll introduce all panelists, then we'll start the questions. It's going to be a question, a Q&A answer question. So, Dr. Shyrine Yaghi, Mrs. Shyrine Yaghi is an experienced marketing and commercial leader currently serving as a co-founder and chief commercial officer at Draft, a leading telehealth platform in the region. With a strong background in negotiation, marketing strategies, digital marketing, and media relations, she brings cross-industry expertise to drive through growth and innovation in digital health. Mr. Rony Krayem, he is the managing director at IP Engineering Pro, where he leads integrated business and networking solutions for advanced technical infrastructure. He is spearheading initiatives to develop technical support systems tailored for the hospital of the future, combining networking experience with the next generation telehealth and smart facility technologies. His strategic vision focuses on transforming healthcare delivery through resilient, cutting-edge engineering solutions. And last, Mr. Elias El Ramy. He is a management and CRM expert with a strong background in strategic planning, project leadership, and customer engagement. Holding a postgraduate diploma in project management from the National University of Ireland, Galway, he has a proven track record in driving business growth and loyalty. Passionate about innovation, and he is currently focused on introducing AI powered software solutions in the healthcare sector, leveraging his expertise in change management and stakeholder relations. I will start question by Dr. Sandy Rihana, order. And please, you can interrupt anytime you want. Let us make it an interactive session. At any time you can ask questions related to the topic that you are asking. Dr. Sandy, the first question. What role does AI play in the development of a new biomedical devices? And how can we make these innovations cost-effective for broad use?
Thank you, Dr. Youssef, for this introduction. Thank you for organizers for this event. So nowadays we're talking a lot about AI in healthcare, AI in medical devices, and nowadays it's something very vital in the innovation in the healthcare system and in medical devices. And not only in data processing, and it's not anymore in the, let's say, reactive medicine, but it's the predictive and preventive medicine, and more in the personalized medicine. Covering the different disciplines. We're talking about neurology, cardiology, emergency, ICU, and many different. So I can mention some of them, and I will link it mainly what exists in the market and how R&D also going from the innovation to what exists in the market. And we will see, like, for example, the deep brain stimulation. Nowadays, like, working in order to detect the epileptic crisis for the different patients in order to act faster and to help saving lives and to give, like, even independencies for the patients and for caregiver. So these deep brain stimulators are now available on the market with big international medical companies using AI algorithm. So we are here in what we call, let's say, the responsive treatment. But what about the predictive algorithm? And here we are more in the R&D and experimental, let's say, predicting algorithm using AI in order to predict epileptic crisis, in order to act as early as possible. And so this is why the research now going on, and us at USAC, for example, collaborating with polystem neurotechnology and École Polytechnique Montréal in order to develop many different predictive algorithms using AI for epilepsy prediction. So another type of applications, basically we know perfectly everyone is using it. So in cardiology, whenever we're talking about a smartwatch, we heard a lot about the FDA-approved smartwatch in order to detect arrhythmia or AFib. So also AI nowadays is used for the classifications of the different cardiac anomalies, taking cardiovascular diseases, the digital stethoscope, and many others. In the COVID-19, AI has been used for also, and many companies also use it for medical triage, mainly for patients going to the hospitals and medical triage before leading the patient to the ICU. Okay, so, and this is also one of the applications that we work on during the COVID, that collecting all these data coming from the patient and helping the hospitals and mainly the clinician to do the medical triage of the patients that will go to the ICU. And the list is non-exhaustive on the chronology, or also in mainly the big boom also in dermatology and the clinical assisted design, so software and radiology, and this is also, it has been shown during the COVID-19 in different medical imaging, segmentation, processing, and let's say classifications, and also the prediction that we saw, like prediction, for example, of breast cancer using the mammograms. So as you see, so the application are very wide, making AI equitable and healthcare for all, let's say, it's a very noble cause, and this should be done. And AI can help, because mainly in the underserved areas, in the rural areas where you have a lack of healthcare expertise. So in this case, these SAMD, as we call software as medical devices, or the integration of the whole remote hospital with IOMT, along with the AI's algorithm, can help these healthcare professionals in order to act in remote areas.
I'm happy to hear this because usually when we talk about this IOMT, Internet of Medical Things, and this related gadgets in healthcare, they always ask us. I was having a conference in Italy, and they asked me, are you using them? Now I can tell them because that we have in Lebanon universities who are doing this application. And I'm happy that you started developing it in Lebanon because we don't want to be theoretical. We have to show how we are using it. It's very important to make sure to help support all the research done in the universities. I will go to Mrs. Shyrine Yaghi. Shyrine, how has AI changed your clinical workflow and patient interactions?
So, as many of you know, we have built DRAP back in 2019. So DRAP first came as a communication tool and accessibility tool between patients and doctors. Today, as we evolved, we have introduced AI for the triage and symptom checker. So whenever you have any symptoms or any disease and you want to consult with your doctor on DRAP, rather than going to ChatGPT and ask him, what do you think that I have? You go on DRAP and you know that the end line is always a doctor. How it's facilitating, because the AI that we call assistive